Well, we're seeing frozen embryo success rates of about 80 to 85% per cycle now. And there's a couple reasons for that. The major one is that we're doing pre-implantation genetic screening on almost all of our embryos. So we, in our practice now, transfer one embryo that's been frozen by vitrification. It's been screened by PGS screening. And that allows us to get pregnancy rates in the 80 to 85% range in all age ranges. We pretty much transfer just single embryos now because the efficiency is so high. So when we looked at our success rates when we even transferred 2 embryos compared to just 1, the pregnancy rates were identical, but the twin rate was about 65%. So we feel that single embryo transfer with a screened frozen embryo is the way to go. Well, you have to be able to freeze the embryos well. So vitrification is something that came around a few years ago, and if you use that properly in freezing your embryos, they're going to be exactly the same as they were before they were frozen, so they're just as good as fresh. The thing that you benefit from when you do the frozen cycle is that you don't have all the estrogen that comes around when you're making the stimulation of the ovaries, and that extra estrogen is probably what makes the uterine lining not as receptive as when we can control it.